My name is Robert Steer, and I'm an attending obstetrician gynecologist at Morristown Memorial Hospital in Morristown, New Jersey. Most babies are born healthy and well, and it's a joyous experience for the parents and a healthy experience for the babies. However, sometimes that's not the case, and birth injuries and complications may occur. Fortunately, this is rare, and usually the outcomes are excellent. But I'd like to discuss with you a few possible complications that can occur and possible ways to prevent them. One of the more common complications that we deal with is the breech presentation. Breech presentation is a malpresentation. It's a problem in which the baby is not facing the right direction for a vaginal birth. Now, normally when babies are born, they're born with their head facing down, pointing towards the opening of the cervix and the vagina. And as labor progresses, they descend through the birth canal and squeeze through the bony pelvis and are born facing the floor, and a spontaneous vaginal delivery usually results. However, not all the babies read the book. A breech presentation is when the baby is upside down. The head is up in the upper part of the abdomen, and over the lower part of the cervix and vagina is either the baby's buttocks or the feet. The breech presentation cannot be prevented, however, it can be treated. If the diagnosis of breech presentation is made early enough, then after 36 weeks, which is about a month before the due date, a procedure called external cephalic version can be attempted. This procedure is done on labor and delivery with an intravenous line inserted and a shot of medication given to relax the uterus first, using an ultrasound machine to see how the baby is doing as you literally push and flip the baby into a head down position. A review of 20 studies looking at the success rate of external cephalic version averaged a 60% success rate. Caput succedaneum is a very common condition of a vaginal birth, commonly known as molding, in which the baby is squeezed through the birth canal and some swelling occurs under the scalp, forming a cone head. The baby's skull is not fixed and fused. The bones have some leeway and give. And in fact, there are two soft spots called fontanelles where the bones have not been joined yet. This is fortuitous because as the baby comes down through the birth canal head first, it's squeezed through a tight fit. And the bones can compress and overlap and cause a reduction in the size of the skull to allow it to fit through the birth canal. And very commonly, molding or cone head is seen, and this is Caput succedaneum. It's a very common occurrence which resolves on its own without any adverse effects. Cephalohematoma is a more serious complication in which blood vessels are ruptured under the scalp and a hematoma, or a collection of blood, forming a lump under the baby's scalp. And we see this in about 15% of babies that are born by vacuum and about 2% of babies that are born by forceps, but it can also occur in babies that are born spontaneously after a long labor. The good thing about this type of hematoma is that it's self-limiting and it's walled off and does not expand. And again, this can go away on its own. It does not have any long-lasting effects, although these babies do have a higher incidence of neonatal jaundice as the blood from this hematoma is broken down and gets reabsorbed. Intracranial hemorrhage, or subgaleal hemorrhage, is a very serious but thankfully rare condition in which larger blood vessels in the baby's scalp rupture and a large hematoma can form in the baby's head. When this occurs, there is a rupture of blood vessels between the scalp and the deep dural sinuses, which contain a lot of blood, and the blood fills a space which extends from the back of the eyes and the orbit around the side of the head to the back of the neck. This occurs less than 1% of the time, but when it occurs, it's a huge problem. The baby can lose 80% of its blood supply into this large hematoma, which can produce severe shock and require blood transfusions. And in fact, 25% of babies that are admitted to a neonatal intensive care unit for this condition die from this condition. Thankfully, it's not common. This is a rare complication, but it does happen from time to time. Sometimes during the birth process, the baby may develop abrasions or bruising or injuries to the scalp. This can occur in a normal labor, which is prolonged, squeezing a baby through a tight-fitting bony pelvis, but it occurs more commonly when forceps are applied to help deliver the baby, or when a vacuum is used to help deliver the baby. Subconjunctival or retinal hemorrhage is also a complication of the birth in which small capillaries in the baby's eyes rupture as it's squeezed through the birth canal. This usually does not cause a problem, it goes away by itself. It is seen more commonly with forceps delivery or vacuum delivery. Does not cause any long-lasting eye problems for the baby. And the only way to prevent this from occurring is to do a cesarean section before the onset of labor. Facial paralysis is a complication of a forceps delivery in which the facial nerve is compressed and damaged by the forceps blade as it's applied between the eye and the ear. The injury usually heals by itself, and long-lasting facial paralysis almost never happens. Fractures of the collarbone or clavicle rarely occur, but can occur also in the setting of shoulder dystocia, in which the shoulder is trying to fit under the pubic bone. Sometimes the collarbone is broken, which allows the shoulders to compress into a smaller diameter that can then fit through the birth canal. The good news about fractured clavicle is that, as my orthopedic surgeon friends like to say, as long as the two ends of the collarbone are in the same neighborhood, it will heal beautifully. Although most of the complications and injuries that I've described from a vaginal birth are associated with forceps or vacuum or difficult vaginal delivery, that's not to suggest that the C-section is the cure-all for all births, because a C-section is a major operation that has increased set of risks on its own. Almost all parents come to labor and delivery hoping for a vaginal birth and expecting a perfectly healthy baby. And that is my hope and expectation as well. The complications that I mentioned are usually rare and of short duration, which resolve on their own. When the babies are born, they're examined immediately to see if there are any of these injuries or problems present and are treated appropriately. My best advice for expectant parents would be to follow the advice of your doctor or your midwife or your labor nurse, because they all have your best interests as well as your baby's best interests in mind.